Thank you for joining us to view this presentation on mental health and caregiving in the LGBTQ community. LGBTQ adults more commonly experience mental health concerns than their non-LGBTQ peers. The stress of caregiving and also isolation that caregivers experience can sometimes further these concerns. And our program will focus on identifying resources to support the LGBTQ caregiving community in their journey. Our program is supported by the Caregiver Teleconnection, a program of the Caregiver SOS at the WellMed Charitable Foundation. The Caregiver SOS provides support and education for family members and friends who are caring for an older loved one. For more information, you can call 1-6491, or you can email caregiversos@wellmed.net. My name is Elliot Sklar, and I'm joined today by my longtime colleague and friend, Lucy Barylak. I'm a professor of health science at Nova Southeastern University in Florida, and after I received my doctoral degree in public health, I went on to work with seniors and caregivers in community settings in addition to teaching and research, which I have been doing now for almost 20 years. I have worked extensively with the LGBTQ community throughout my career, and I've published and presented research on caregiving internationally. Now, Lucy, please introduce yourself.
Thank you, Elliot. My name is Lucy Barylak, and I received my master's degree in social work at McGill University. I worked in the healthcare system for over 30 years. My main focus has been caregivers, developing programs, research development, publishing, and presenting my findings in major international conferences. I received the Queen's Jubilee Award for my role in developing a national coalition to support caregivers across Canada. But most important, I was a caregiver for my mother for over 10 years. We're here to discuss mental health, which is central to my professional background. I was in charge of the mental health for seniors department while working in a healthcare community center, and I experienced the difficulties that people with mental health go through as well as their caregivers. You know, the LGBTQ adults more commonly experience mental health concerns than their non-LGBTQ peers. The stress of caregiving and isolation that caregivers experience can further these concerns, which we'll talk about today. LGBTQ people experience alarming high rates of mental health challenges. Over a majority of LGBT adults in the United States are facing significant mental health challenges today, according to the data from the Human Rights Campaign. LGBT individuals are more than twice as likely as heterosexual men and women to have a mental health disorder in their lifetime. According to some research studies, they are 2.5 times more likely to experience depression, anxiety, and substance abuse compared with heterosexual individuals. Despite the growing number of older adults identifying as a sexual minority, and this group's historical and current experience of stigma and discrimination, mental health in older LGBTQ adults remains understudied.
And so our recorded program here today is intended to share resources and information that you can watch at your leisure and refer back to. You can also feel free to share this program with others. This is a very important area of health disparity, meaning a health issue that affects one group with greater burden or severity than with a specific population that we don't discuss enough, perhaps because we are not aware of this issue. And mental health affects caregivers greatly, just as caregiving can affect mental health. So in 2021, about 15% of people 50 and older experience mental health problems or concerns, such as anxiety, depression, severe mood disorders, or bipolar disorder as an example. And that's the newest data that we have available from 2021. And we need to keep in mind that this was during the time of the pandemic. So it is not just LGBTQ plus adults, but people are often surprised to learn that rates of mental health disorders are rising fastest actually among baby boomers. And the number of older adults with depression is expected to double between 2010 and 2030. So we're almost there at 2030, and I wonder what the data will show. Prior research has also identified a possible link between negative attitudes toward aging and the mental health of older adults. Ageism, which the World Health Organization defines as the stereotypes and prejudices against people based upon age, is a major contributing factor to mental illness because it may lead to the internalization of negative and damaging self-perceptions. We go through a lot of changes as we age. The death of loved ones, medical concerns, retirement. These things can make us feel uneasy or insecure, stressed, or sometimes even sad. And in addition, things around us change as we age that we have very little control over. For example, many people are struggling because of inflation, and that has placed financial strain on many retired persons. If you have limited financial means, you may not go out as much, which can compound upon social isolation that caregivers sometimes feel, which can also negatively impact our mental health. So this is something that we've talked about during our Pride of Caring series this month as it relates to LGBT plus caregivers who report feeling more isolated in their caregiving role. It's normal to go through an adjustment period after experiencing this kind of a life event before you can sort of adapt to a new normal. But for anyone watching or listening, interfere with your daily life or your functioning, seek treatment. It is important that we recognize that depression is not a normal or healthy part of aging. And unfortunately, older adults are often hesitant to reach out for help due to persistent stigma around mental health issues and also generational differences in how these disorders are perceived. And aside from all the data that we know that mental health issues are underreported and often underdiagnosed. So it's important that the Human Rights Campaign is bringing this attention to light among the LGBTQ community. But it's also important that we recognize that mental health is an issue for many people. According to the CDC, 1 in 5 US adults live with a mental illness, and about 1 in 25 live with a serious mental illness. The National Institute of Mental Health estimated that in 2021, 22.8% of adults over the age of 18 had a mental illness, with young adults aged 18 to 25 as having the highest prevalence. The American Psychiatric Association estimates that about 19% of adults experience some form of mental illness in a given year. That can be, for example, a period of depression, with 4% having serious mental illness and about 8.5% having a diagnosable substance use disorder. So we use a more broad terminology today encompassing mental health issues or mental health concerns because caring for someone with mental illness can vary tremendously. You may know someone who's being treated for depression and who usually seems fine, but might be going through a depressive episode. For other people suffering from depression, their experience can be very different. And conversely, you may have seen a change in mood or affect of a loved one during the course of the pandemic, as another example, which may have changed. People with mental health issues often cycle on and off of medication too, which can be a very wild ride for that person and people around that person. It can be very challenging to care for someone with mental health issues because of all of the challenges inherent to mental illness. A bad knee can impact someone's mobility, but poor mental health can affect everything, including a person's desire to even be mobile. If you think about it, many caregivers themselves have had periods of challenge, and as a result, that impacted relationships around them. I know of some caregivers who've used alcohol to cope, which has then had other impacts on other relationships. One of the most difficult things, I think, about mental health issues, see mental illness and mental health issues sometimes as a weakness or failure, or even a lack of motivation, which it is not.
Thank you for that, Elliot. Some of the factors that lead to this higher occurrence of mental health issues among LGBTQ adults are complex and numerous. The added effect of ageism and bigotry may heighten the risk of mental illness and other adverse health outcomes among the older LGBTQ adults than their non-LGBTQ peers. Our political environment can also contribute to psychological stresses among LGBT adults, and we're in an election year. There is concern among many older LGBT adults about our current political climate, which has been pulled apart and divided. So let's look at why is this happening, some of the factors that may contribute to all this difficulty. So there could be minority stress. LGBTQ individuals often face higher levels of stress due to the experience of discrimination, stigma, and prejudice. This minority stress can lead to an increased risk of depression and other mental health issues. Now, there could be social rejection and isolation. Individuals may experience rejection or lack of acceptance from family, friends, or society at large. This social isolation can contribute to feelings of loneliness, sadness, and depression. Internalized homophobia or transphobia, having feelings of shame, self-hatred, or negative beliefs about one's sexual orientation or gender identity can contribute to depression among LGBTQ individuals. Bullying and victimization. LGBTQ individuals, particularly young people, are at a higher risk of bullying, harassment, and victimization. These experiences can lead to significant psychological distress and increase the likelihood of depression, as well as co-occurring mental health issues. Individuals are more likely to experience co-occurring mental health issues such as anxiety disorders, substance abuse, or post-traumatic stress disorder. These conditions can contribute to depression and increase depressive symptoms. Now, there could also be healthcare disparities for LGBTQ. Individuals may face barriers when seeking healthcare, especially in mental health services. These barriers can result in limited access to appropriate support and treatment for depression.
And these are not all of the reasons why, they're just some of them. But it's really important that we recognize that people's life experiences vary widely. And not all LGBTQ plus individuals experience depression. Also, the prevalence rates can vary across different subgroups and populations within the community. So it's important that we state that, and that also not all older LGBTQ adults have the same life experiences. Imagine how different one's life experience may have been growing up in New York City versus North Dakota. Additionally, societal progress, increased acceptance, access to affirming support, all of these things can help to mitigate risk factors associated with depression in the LGBTQ plus community. There are efforts certainly to address depression within the community, and these should really focus on promoting acceptance, creating supportive environments, providing accessible mental health services, and also, wherever possible, implementing policies that reduce stigma and discrimination. And those policies can exist within organizations. So what we call culturally competent care is healthcare that considers the unique experiences and needs of individuals that become effective for their support and treatment. One of the first challenges that many caregivers and patients experience can be diagnosis. And many patients are also very reluctant to seek care. This can be especially true for members of the LGBTQ community who might have had negative experiences with mental health care in the past. Now, we need to remember that the American Psychiatric Association regarded homosexuality as a mental disorder until 1973, only 51 years ago. Stonewall, the movement that began the Pride movement as we know it today, occurred only 55 years ago this June. And it's only been a few years since conversion therapy, which is aimed at converting someone's sexual orientation, was banned. So it's important to consider the life force experiences of the individual and also what type of mental health encounters or experiences they may have had. The truth is that mental health challenges in the LGBTQ community are in great part due to stigma, discrimination, and bias in all of its forms. However, LGBTQ plus people also face gaps in health insurance coverage. In the US, about 18% of LGBTQ adults of color have no health insurance coverage, compared with 8% of all adults. This is important because access to care obviously includes mental health care, and we have to find solutions to address these inequities. Mental health among LGBTQ plus individuals and caregivers is a complex and multifaceted topic, and it involves understanding the unique challenges and experiences faced by LGBTQ individuals and also those who provide care and support for them. So, if you're trying to find mental health care services, you may want to ask a local LGBTQ community organization if one exists near you, or other health organizations, for example. You can also look up local therapists on Psychology Today who specialize in LGBTQ issues and treatment. And if you live in proximity to an LGBTQ community center, as I mentioned, you can certainly try to ask them for names of therapists in your area. Sometimes it's difficult to find which specific mental health issue might be causing a person's symptoms, and it makes diagnosis sometimes challenging because symptoms, for example, can sometimes overlap. As an example, many caregivers experience sadness and anxiety at different points in the caregiving journey. Sometimes these are passing experiences, and sometimes they can also be longer in duration and more characteristic of a more serious issue. So taking the time and effort to get an accurate diagnosis is so important to helping with getting appropriate treatment.
You're so right, Elliot. Many people enter counseling these days without any diagnostics. And this includes telehealth for counseling, where people meet virtually with therapists. But I think it's so important before you do this, you really need to determine what is your diagnosis, what is affecting. Is it a mental health issue? It could be maybe a medical condition. So it's extremely important that that you are examined by a physician. Your doctor will try to rule out physical problems that could cause your symptoms. For example, sometimes health conditions and medication can cause changes in mood and behavior, even over-the-counter medication, or you could be having a urinary tract infection. And so your moods has changed and you appear to have a little bit more depression. Now, there should be some lab tests, possibly. This may include, for example, a check of your thyroid function or your hormone levels. And then there should be a psychological evaluation. A doctor or mental health professional can talk to you about your symptoms, thoughts, feelings, and behavior patterns. You may be asked to fill out a questionnaire to help answer these questions. So once you know your diagnosis, counseling may be what you need. So it's important for an older person with symptoms of depression to seek treatment as it is for someone younger. The impact of depression on health in older adults can be severe. Much research has reported that depression is associated with worse health in people with conditions like heart disease, diabetes, and stroke. Depression can complicate the treatment of these conditions, including making it more difficult for someone to care for themselves and to seek treatment when needed. In older adults, depression may be disregarded as frailty, or it may be viewed as a result of life changes, chronic illness, and disabilities. Recognizing the signs and seeking a health practitioner is the first step to getting treatment, which can make a real difference in your life and your quality of life.
That's for sure. So an important distinction too that has been found in research, in practice, also in conversations informally and formally with older LGBTQ adults, is that they have higher rates of anxiety, depression, loneliness, and suicidal thoughts as compared to their heterosexual counterparts. So we stated that earlier, and I'm reporting it, and I am repeating it rather because it is important. It is important because medication might not be the fix of that alone, because genetically heterosexual and non-heterosexual individuals are not different. And so I think it's important that we take pause and we sort of think about that. For example, older LGBTQ plus adults may experience anxiety about illness and the need for long-term care because of having to come out to healthcare staff, or instead of having to feel like they need to keep that private. So it can create further isolation within a nursing home facility if you feel like you're the only LGBTQ plus identifying person, or of not having the financial means or not having close family nearby to care for you if you need it. There are a lot of concerns that happen as we get older. And this is true also for caregivers. Who would provide care for you if necessary? These are scary questions that many people ask themselves at different times. And it's important to consider circumstances and how feelings and anxieties might help to be resolved through counseling or speaking with a social worker so that you have a plan in place that can help people feel a lot of relief. And for example, having a plan in place can give you a relief from anxiety, much in the way that medication might or might not be able to fix that, because medication alone doesn't address the root of the problem. So medication, as I was saying, might be helpful, might be not, depending on your circumstance, but it's definitely another option. And treatment depends on the type of mental illness or issue that you've been diagnosed with. Also the type of severity, and it's a matter of trial and error to see what might work best for you. That can be different for different people, and medications sometimes react differently for one person than for another. So in many cases, a combination of treatment that involves counseling, visits with your primary care physician, and perhaps medication all together can work best for some people. So if you have a mild mental illness with well-controlled symptoms, treatment from a primary care provider can be sufficient. However, sometimes a team approach can be better if you have a more significant mental health issue. You might want to involve a psychiatrist who specializes in medication treatments for mental health. And although psychiatric medications do not cure mental illness, they can often significantly improve symptoms. Psychiatric medications can also help make other treatments, like counseling, more effective. The best medication will depend on your particular situation and how your body responds. I mentioned earlier that medications are very helpful, but they're only very helpful when people stay on them or don't abuse them. Some of these medications have significant side effects and others more mild. As an example, anti-anxiety medications and sleeping medications are both depressants. Most people don't recognize that, so it's important to use them as your doctor prescribes, and to take a moment to realize if you're feeling down after being on these medications routinely. One of the keys for successful treatment is open and honest communication with the provider. And a caregiver to people suffering from mental illness, we need to recognize that medications have adjustment periods as well. It can be very challenging to provide care to someone who's suffering from a mental health episode or to bear with them as they're adjusting to a medication, which can impact sleep, their overall function, weight, mood, and behavior. And we're learning actually now that more medications than we thought might have impact on our mood and our behavior. Medications ranging for diabetes to high blood pressure and so on. One of the frustrations I think a lot of people are feeling about science right now is a lack of new approaches to treat mental illness with psychopharmacology, medication. For example, there have not been many new antidepressants to enter the market. And if you notice ads on television, they advertise adjunctive therapies for depression, meaning you can take a second medication to help make your first line medication more effective. I often joke that you'll never hear exercise advertised on TV to benefit your mental health or your physical health because no one stands to profit from it. But sometimes just taking a walk and making a practice of that can completely change our mood and our outlook on things.
You're absolutely right. I know from my own experience, when I sort of feel down, I go for a little walk and it really helps. You know, one of the hardest questions we get asked is, how do I encourage the person I care for to get treatment? You know, you might find that the person you are supporting doesn't want to get treatment. This might be because many reasons. And what I do want to say is that when someone with mental illness, they're the ones that have to be able to agree to receive treatments. But let's look at some of the reasons. They don't think they need help and things will get better on their own. They don't think treatment will work. They possibly don't understand that they are unwell and they are in denial. They could be scared of what will happen to them if they tell their doctor how they feel. They could be worried about other people, what they might be thinking about them, since we are talking about that there is stigma in our society about mental health. It's not viewed as a disease. Worried, they could be worried it will affect their job or other aspects of their lives. Feel helpless and are reluctant because of past experience that they may have had when going for help. So if the person you care for doesn't want to get help, it can be very frustrating. So I kind of want to look at a few tips that might be helpful. Now, one of the most important thing is to talk to them about how they feel. Ask them why they don't want to get help, but also ask them what are they feeling. Explain that you are worried because they seem upset, down, and you care about them and you want to help. Explain what kind of help they could get. So find out before what is available and offer to help them talk to their doctor or offer to talk to their doctor before their appointment, obviously with their consent. What's so very important is don't get angry at them. You really, really have to stay calm. You know, some people might refuse to get help even if you try to support them. It's important not to give up and to stay hopeful. It might take a while before they get help. This is why self-care is so important for you as a caregiver, but especially when the person you care for suffers from mental health issue. Take time for yourself. Take breaks. Be sure to get out and change your environment. Exercise or walk in nature can be very helpful, as we said. It really does boost your mood. It can also be something that you can try to do with the person you care for. Offer to listen to the person you are supporting. Listening to someone doesn't mean you have to say much back to them or come up with solutions to this issue. Sometimes they may find it helpful to just talk to you about their problems and to know that you are there to listen. Don't be afraid to ask them questions about how they are feeling and listen to their answers. If you aren't feeling great, if they aren't feeling great, ask if you can do anything to help. Make sure you don't take on too much or that they are overwhelmed. So it's really a balancing act, but at the same time, try to keep as calm and as quiet and supportive as you possibly can.
I think all those tips are excellent ones. Two more tips that I have to share that I can think of as we're speaking is sometimes being that person and helping a person get help when it becomes very frustrating. As you were saying, it can be very frustrating for a caregiver, for a friend, for someone. Um, some of us are just not meant to do that, as an example. And so that's the reason why we have so many resources that we're going to be providing, including the ones right here on this slide. It's great to be able to refer people for mental health crisis hotlines, I think. Also because it requires no commitment, it's anonymous, it's easy, it's something you can do from home. So for people who are feeling like they don't want to receive or accept help, for example, the 988 line is a wonderful one. And there's another new one through Sage that we're going to talk about with our resources a little bit later. Um, so I think that that's an important thing for us to think about and consider too, because it can be very, very frustrating. And some of us have more patience than others. So um, referring people for help where appropriate is important. And I think another thing that I have realized in healthcare environments recently is there's a lack of mental health and social work all around. We need more case management. We need more intervention. And so wherever it is possible for you to advocate, to speak with someone, if you feel that a situation is concerning, please do so. A concern that many caregivers have expressed over the years to Lucy and I is how to deal with a crisis situation. And the best way to deal with it is by not having one come up wherever possible. So planning can help to avoid crisis in many cases so that you know what you'll do, you know who you'll contact. And having a personal plan which has information about signs that a crisis might happen and what you can do if it does can be very helpful. A crisis situation can look very different for different people and in different circumstances, and it's important to speak with your healthcare provider and your loved one's healthcare provider and ask questions. If you're concerned about a loved one or a member one, but if there is no immediate emergency and you are worried about someone's mental health, SAMHSA has a wonderful national helpline that can provide referral and treatment information. They also provide services in multiple languages, English, Spanish, and others. And they have a service to provide referrals in your local community, as well as to support groups and community-based organizations. And there's also the online treatment locator that they have. You can send a text from your phone to the number Help for You. That's 435748. It'll also be in our resources. And you can communicate with them via text, which can be very helpful for some people who also don't want to say anything out loud around someone that they're worried about. So the 988 hotline as well, that's something that came out new last year. And again, multiple languages, provides also referrals in the local community. And we have a lot of resources to share with you at the end of our presentation.
Thank you for that, Elliot. Elliot and I always tell caregivers, if you don't care for yourself, you will not be able to care for someone else. It's really so important to look after your mental and physical well-being. If you are caregiver for someone with a mental illness, you might find it stressful and difficult, and I understand for sure why. It's so important to look after your own health and well-being. We keep repeating it because it's so important. You can try some of the following things to help look after yourself. Understand that what you can and cannot do. That's really important as a caregiver. Some things are beyond your ability to do so, and you have to recognize it. Understand what the person you care for can and cannot do for themselves, but try to let them be as independent as possible. Give yourself time to do things you want to do, such as a hobby or leisure activity. Try and keep physical active and have a well-balanced diet and definitely get enough sleep. Set up some boundaries. Now, those are important. You can do this by deciding how much you can do and how much you want to do. Okay, there's a big difference there. And you're allowed not to want to do. We give you permission. Talk to the person you care for and try to agree about boundaries together. So it's really very clear to both of you what their expectation can be of you. Remember, once you set up these boundaries, it's important to stick to them. What I want to kind of say to you is you cannot make them better. It's really out of your control. And acceptance is so important. They're the only ones that can accept help. And God willing, they'll come to that point where they'll recognize it. But as long as you have the patience and the willingness to care for them, at the same time, care for yourself.
Everything you said is so important. And I think it's important to recognize too that when we're caring for people that have mental health issues, I was talking about planning. I think it's important to plan that we look after ourselves too. And a good example is I have someone in my life who has some mental health issues. And when I am in a caregiving role for that person, I try to balance that by making sure that I block some time for myself after I'm interacting with that person to recharge my battery because I realize that they drain from that source of energy and I need to replenish it. It's important for my mental health and for my mental flexibility, I think. And it's important that I think more people take time to recognize that we need to care for our own health and mental health, especially when we're in the role of caring for someone else.
For sure. I was just thinking of one of the other challenges that caregivers face also is the fact that many times the person you're caring for doesn't want to share what they've discussed with their doctor and even the medications that they're taking. That's a form for them to have some control over their life. And that is extremely frustrating for some caregivers because they're really not sure, are they taking their medications at time? That's why when we're saying that you kind of have to step back, because you don't have control over that. And the only way to sort of just is to listen to them and for them to feel that you will, when they're ready to talk to you, that you're there without judging and sort of just accepting and being there. It is a very challenging caregiver role to play for someone with mental health issues. There's one more thing that I also want to talk about, Elliot. You were talking about planning, which is very important. But if you know that the person you're caring for can be either physically or emotionally, they can get easily angry, or, you need to prepare for that as well. And to make sure that you have either to contact people to call and say, look, I'm having a hard time, can you come over? Or worst case scenario, to be able to call 911. Because you really need to make sure that you're not harmed in any way, and neither are they.
Absolutely. And the resources that we'll be sharing are very helpful, not just for people with mental health concerns, but also for caregivers in that light, who might want to, bounce some ideas or vent or need to talk with someone who can give them a little bit more expertise. Lucy, you were saying one of the challenges can be that people don't disclose perhaps what they might have shared with the doctor or what they might have been diagnosed with. That's one of the challenges for caregivers in the LGBTQ plus community, that we become caregivers at a higher rate than our non-LGBTQ plus peers. We become caregivers to friends, to neighbors, to community members. It's often because we don't have children, and the people for whom we provide care don't have children either. And so the challenge there is, from a legal standpoint, we might not be privy to certain information or to call a doctor if we're concerned about a friend or someone that we are looking after, because we might not have the ability to share information or have a conversation about things that are confidential and related to someone's health. So these things can be very challenging. It can be challenging too, as I mentioned, to find a social worker or someone in a hospital environment to engage if there is an issue. And sometimes we don't have the legal responsibility. So that's where all of these amazing resources that we have here on this slide for you become all the more important. And we've divided them up into categories. So we have some on mental health and aging. We also have, and it's resources, not resource. I apologize for the typo. We also have some mental health hotlines and resources, including the National Suicide Prevention Line and the Crisis Text Line. But we also have the LGBTQ specific resources, and I want to mention specifically SAGE, Services and Advocacy for, and their terminology is GLBT Elders. They have a new program in collaboration with Hear Me, which is an LGBTQ plus founded company that provides on-demand mental wellness through an app. And they have an amazing collaboration. You can find more information on SAGE's website. But these are all a bunch of different resources. We couldn't get them all together for you, but certainly feel free to refer back. And anything that you see that is underlined in blue is hyperlinked, and you should be able to click on that on your screen. In addition, I wanted to once again refer everyone back to the Caregiver Teleconnection YouTube channel, which has a number of different recorded programs on different topics, several more as part of our Pride of Caring series this year, as well as from years past. And if you need to reach out to someone, you can certainly call the Caregiver SOS at 1-866-390-6491 or caregiversos@wellmed.net by email. I want to thank you all so much for watching our program, and I hope that some of the information and resources that we shared were helpful.
Thank you, everybody, for listening to us. And once again, I want all you caregivers, please take care of yourself. Thank you for all that you do. Take care and bye-bye.